Hello, my name is Jason Straw, and I just want to let you know who some of the players are in the medical cannabis fight. In 2017, I went down with Jeff Staker to the Indiana State House to talk to the newly appointed Indiana drug czar, who is Jim McClelland. It's this gentleman right back here. And we discussed doing a pilot study for medical marijuana to treat opioid addicts. And I explained to him that Maine and Massachusetts were doing some of these studies already, and they were having a lot of success, a lot better success than any treatment that we've had in the past. And I gave him the research, I gave him the findings, and I said, look, these are pilot research studies. One of them was a 100% success rate for the first 6 months. And these people are still having benefits from being on medical marijuana. And medical marijuana, as we all know, you don't overdose on it. Methadone, Suboxone, people overdose on that. They're opioids. They use low-dose opioids, which can be very addictive and very hard to get off of for some patients. So just because you're using the medical-assisted treatment doesn't mean that you're getting off of the addiction. It just means that you might be stepping down from something that they consider to be more harmful. But you still have opioids going into your system which can build up and cause harm. So these work for some people, but not all people. For other people, you need something that you're not going to overdose on, that can help you, like the medical marijuana. And we tried to explain this to Jim McClelland. Just go to the governor and open one clinic with medical marijuana. Ask for the legislators to start doing the research here in Indiana, like they're doing in other states, which the federal government was refusing. And he said, okay. And that was 2017. It's 2019. We're looking at 2020 here pretty soon. And he went with IPAC, who said that that marijuana is not medicine, which is contrary to what the federal government has said. You know, you have two agencies saying that marijuana is not medicine. The DEA says Schedule 1, even though they have Marinol, which is pure THC, that the FDA approved and is using as medicine since 1984. You have Epidiolex, which is a CBD extract. And so you're looking at these things and it's like, okay, so these things are from the plant, and they're saying that we can't use marijuana because it has higher levels of THC. Well, they've been using man-made synthetic THC that's 100% since 1984 to treat cancer patients and AIDS patients. And the AIDS patients, they use it for nausea or for an appetite stimulant. An appetite stimulant. They're giving people pure THC for an appetite stimulant. Well, so they're scaring people about THC, which never killed anybody from an overdose, where MAT, medical-assisted treatment, Suboxone and Methadone, has killed people. So the idea is to do less harm or no harm, and we're not there. We're still doing harm to people in the medical community with these recovery programs. I mean, they're a step in the right direction. They're better than people using fentanyl or carfentanil, which can kill you the first time you use it because the dosing is so small and people on the street don't know how to dose it. I give lots of it as a trauma nurse when I was downrange in combat, and even in the ICU to patients who came back from surgery, or traumatic surgeries. It's incredible the amount of medication that some patients need. But now that you know who Jim McClelland is, and that he agrees with IPAC that marijuana is not medicine, he's somebody that has the ear of the governor and was appointed by the governor. And he ran Goodwill. I mean, so he's not a bad guy, he's just misinformed. So we need to get these people informed. These people on the right track of moving it to the next step. Thank you for your time. This is Jason Straw. I'll see you again.